And does putting kids on medication when they're young people increase their risk of addiction long term, or them becoming reliant or addicted to the medication or other addictive elements?
Yeah, so it's a tricky one that has been studied, but kids with mental health conditions may be at greater risk of substance use in adulthood anyway, and we know that young people with ADHD, conduct disorder, oppositional defiant disorder, the three behaviour difficulties, are at increased risk, and they tend to be more impulsive. They tend often to hang around with other people who are getting into substance use things, and they often have more novelty seeking. They like doing new things and experimentation. So you have to account for that, and a number of studies have with ADHD in particular. It's been controversial because you're giving a medicine which, if not used appropriately, can be abused or diverted. Um, and it makes sense that it could increase the chance of substance use difficulties in adulthood. But there are probably 10 or 11 good studies looking at that, a number of reviews where it consistently reports that there isn't an increase in substance use over and above the usual risk. So that's quite good to know. And there's some concerns, apart from ADHD, there's some concerns around SSRIs. So some people are worried that SSRIs may be addictive, and there's something called discontinuation syndrome. So short-acting SSRIs like escitalopram, paroxetine, citalopram can be hard to stop, but people don't seek them out. They don't pay money for those things. It's not a drug of abuse, but people can have difficulty stopping it when they try and reduce. They get irritable and can get shocked things through their body and not sleep and feel terrible. And generally, when we suggest people come off SSRIs, we're using longer acting medicines. So fluoxetine, it's very rare that people would get those symptoms with fluoxetine. Quite uncommon with sertraline, but can occasionally happen in some vulnerable people. But we would always suggest that people come off quite slowly anyway, and that if there are issues, people go even slower. And sometimes if you're on a short-acting one, you need to be transferred to a longer-acting one to kind of reduce the medicine over time if you want to come off it. But most people don't have too many difficulties, but some people have massive difficulties. And then occasionally people are started on a benzodiazepine. So in child and adolescent psychiatry, that's pretty rare. And we would use them for people with bipolar disorder or psychosis short-term, because if you use short-acting benzodiazepines for longer than 3 weeks or so, you can get difficulties with stopping it and dependence with some people, and that could conceivably increase your chance of substance use later in life. So that, yeah, there is some concern around benzodiazepines. So that's diazepam, lorazepam, clonazepam, that group, particularly the shorter acting ones like lorazepam.